Betty Shiels. Dr. Betty Shiels is the director. You picked one director here for the Kentucky Emergency Preparedness for Aging and Long-Term Care Program. So we're glad to have you here.
Thanks, Pam. And shout out to Michelle Hines there in Barren River. We've worked on a lot of projects over the years.
That's right.
Good to see you.
Good to see you too, Betty.
Actually, we started out our work working with all the AAAs, all the area agencies on aging across Kentucky in 2004, working to get preparedness planning done for all publicly funded agencies serving seniors living in the community. So we trained every area agency on aging for a number of years across the state in their emergency preparedness planning and their emergency preparedness guidance for their agencies or for the programs which are funded through their grants. So I wear a couple of hats, as you can tell. My concentration for a lot of years has been with nursing facilities, but over the 16 years I've been at this, I've also worked with all of the areas that would involve community-based seniors. I'm also co-chair of the Kentucky Functional and Access Needs Network that focuses on emergency preparedness for all functional and access needs populations, especially those elders living in Kentucky. So it's not
forwarding?
No.
Let me see what options I have here. So we're having a little technical difficulty. Let me see.
So while Pam's working on that, let me just say that I'm very aware by your introductions that we have a very varied range of specialties, disciplines, and interests. And I decided to do a focus that speaks more to those working in area agencies on aging. Nevertheless, a lot of my content is applicable to community-based elders and those living in residential settings. For those of you, for the woman who is involved with the Medicare, with Medicaid, we work with Edward from the Medicaid office, who is a core member of the Kentucky Functional and Access Needs Network on Medicaid issues, as well as the Department for Aging and Independent Living and the Department for Behavioral Health. On the Medicare side, I focus on long-term care and the final rule for emergency preparedness for long-term care, as well as the other 16 different categories of healthcare providers in their emergency planning. The population of persons living in the community.
This is what we're going to do. It's not allowing me to actually forward the slides due to the restricted nature. So what we're going to do is they're not going to be able to see the slides, but you'll be able to see them and talk through them. Okay?
Okay, I do have a flash drive.
We might be able to do that.
Well, let's not take up the time.
Sure.
The most important thing for any of you to understand are the top 13 hazards identified for Kentucky by Kentucky Emergency Management. Every region, every AAA, every community, every county in Kentucky, all 120 of them, have a hazard vulnerability analysis that they've had to develop for their county and for their agency, especially if you're in healthcare. And the top hazards include flood, which is number one, no matter where you are in the state, flood is the number one natural hazard. Second is earthquake, because we're exposed to two major fault lines in the west, the New Madrid seismic zone, and on the east, we're exposed to East Tennessee seismic zone. Both of those are two of the most active seismic zones in America. So we do spend a lot of time every year working with all of the first responding agencies and all the state agencies related to emergency preparedness and response, planning for the big one in terms of an earthquake. Karst and sinkhole are a major risk for Kentucky. We rank number 2 to Florida in sinkhole risk. For those of you in the Barren River area, you do have significant sinkhole risk. If you think about the sinkhole that opened up at the Corvette Museum and 11 antique cars went into the sinkhole and were never seen again, that's an indication of those risks. Forest fire, if I'm doing outreach and I'm working in someone's home with visitation services or any service in the home, I want to be aware of forest fire risk because you need extra time to be able to get out. Extreme temperatures, whether it's cold or heat, severe storms, severe winter storms, and obviously tornadoes. The challenges for emergency planners, first responders, and shelter operators, Michelle Hines is well versed in this, is that Kentucky ranks 10th in the percent of elders in America of all the 50 states and metropolitan areas. Those 65 and over in Kentucky experience poverty at a 20% greater rate than the United States as a whole. Kentucky ranks 3rd in elder poverty, and Kentucky ranks 2nd in adults with disabilities. So when we talk about vulnerable populations, we are really talking about some of the most vulnerable populations in any of your areas. Kentucky also ranks 7th in the nation in presidential declarations of disaster over the last 15 years. You wouldn't think it. You'd think it's the coastal states. But Kentucky has tremendous exposure due to its geography and due to the geology. We're focusing a lot.
If you guys could go on and make sure that your microphones are turned off, that would be in the lower left-hand corner. That would really help us with background noise. Thank you. Try again, Ben.
One of our concerns for the population living in low-income housing, affordable housing, HUD-funded senior housing, whatever terminology you want to use, is that these properties tend to be multi-story, multi-family properties. Tenants move into these buildings when they're ambulatory and when they have reasonable health conditions. This population has the longest tenure in affordable housing and low-income housing. They live there the longest, and they tend to go from HUD-funded housing to the grave. Because one of the purposes of the Medicaid waiver is to keep people out of nursing homes. So we've got, in some cases, a nursing home population living in community housing that is funded by HUD, the Department for Housing and Urban Development, but HUD creates this housing through loans to property developers. There are not programs that operate in these buildings. They are apartment buildings. So your clients living in those buildings are tenants. They are not residents like in a nursing home. So they are, in essence, living independently in buildings owned by property developers from outside of whatever community it is. And those properties were developed as tax shelters. So HUD, as the funding unit for the developers, does not have guidance for emergency preparedness for the tenants. They have no responsibility for emergency preparedness for the tenants. So when you are working with an in-home visitation in any type of HUD-funded housing or public housing, if you will, whatever planning is happening is planning done by the tenant themselves and their family. Now, many of the area agencies on aging do have requirements and or guidance for their staff to assist the client in developing an emergency plan, an individual emergency plan. And that's a good exercise. And one of the reasons it's a good exercise is if you're working with these folks, you really need to have your own individual emergency plan. Because if you don't have your own and you are working and you're on site out of the home, your family needs to know what your plans are and you need to know what your family's plans are so you can service the client as expected. Families tend not to be involved with this population. What property managers tell me is they don't see the family beyond the first day the person comes and their first day moving into that building until they die and the family comes and fights over what's left. So a lot of these folks don't have backup support, don't have family units that would come and assist them in an evacuation in advance of a storm. So we've got a lot of vulnerability here. This population also is under-identified by community resilience planners. It's acknowledged that there's inadequate planning. It is not acknowledged that this is a primary population for emergency managers and first responders. I've spent 16 years pounding on tables with this message, and they're finally beginning to get it, but still, because it's not a visible population, and they don't tend to make a lot of noise, and they're tenants, not clients or residents within that building, they are underrepresented. Site managers at these buildings, to add to the risk for your clients, are part-time. They generally are managing 3 to 5 other buildings, and they might visit once a week, sometimes 2 or 3 times a week, but it may not even be once a week, depending on how many properties they are managing. And they're worried about the building. They're not worried about the tenants. This population is also creates a significant burden on the shelter system, because this is a population that may make up half of an emergency shelter. And they have special needs, as any of you who work with these folks know. I'm not going to go into everything you already know about the numbers of chronic conditions and the numbers of medications they take and where they are with ADLs and IADLs. I just recognize you are dealing with a highly vulnerable population. Transportation options are limited in an emergency for these folks. If you are working and there's a disaster that happens while you're visiting, and you are worried about the client or you're worried about the property you're in and your safety, call 911. Don't call anybody else first. First, you call 911 and tell them what's going on. Your clients may need assistance with ambulation, dressing, toileting, medications, oxygen management, sight and hearing impairment. What we learned with Hurricane Katrina was that many of your clients, when they were evacuated to a shelter, lost their wheelchairs, lost their walkers, lost their eyeglasses, lost their hearing aids. And the deaths that occurred in those shelters from sheltering that population occurred for conditions that were treatable. They did not die of their chronic conditions. They died because they couldn't communicate. They couldn't hear when meals were being served. They couldn't see to get to the toilet. So when you have a chance to advocate on behalf of your population, especially in Red Cross and community shelters, I encourage you to advocate on behalf of the range of their needs, and don't hesitate to ask what that shelter's plans are to take care of those folks. Because under the ADA Supreme Court ruling, Red Cross shelters and publicly funded shelters have to make accommodations for your clients in the shelter. Your clients, by and large, don't fall under the definition of nursing home eligible. So nursing homes are not a shelter. In order to be nursing home eligible, you have to spend at least 3 nights in a hospital. During a major disaster, there may be a waiver of that, but your client is not necessarily going to fall in the priority category for those folks. One of the things we learned from Hurricane Sandy in New York was there was some very good research done of the population you serve about their preparedness. 27% knew of programs and organizations that do help prepare for disasters. Half of them indicated they would have difficulty exiting a building if they needed to evacuate. So that lets us know that they need physical help. That physical help needs to be the fire department, emergency management, and other first responders, not you. 43% knew of community shelters, but over half of them indicated that they would not go to a shelter. And we have experienced that over 16 years with all the disasters we've had, time and time again. Older persons like to be self-sufficient. They do not want to be dependent. They do not trust community shelters. So it's very difficult to get them to a community shelter. 23% had emergency evacuation plans, and I would imagine most of those live at home as opposed to live in multifamily housing. And then a reported 92% did know of somebody who within 50 miles who might come and get them, who could provide transportation. Nevertheless, they would hesitate to contact them and ask for help. Trusted sources for information during a disaster is in a way unique for your populations. In that, given the technological advances that have been made over the years, you'd think that smartphones and emails and everything else would be a great source for information for this population, and it's not. The best source of information is television and radio, because they trust the mayor, they trust the county judge, they trust the head of the water department, etc. They don't trust people necessarily through electronic means of communication. One of the risks, or a range of risks, that community-based elders deal with is citywide power failures, high-rise apartment buildings. In a high-rise apartment building, if there's a power outage and the elevator goes out, getting people evacuated from the higher floors becomes a nightmare. And if people moved in ambulatory and moved out on electric devices or in wheelchairs or walkers, they may not be able to get out of that building. If it's a bariatric client, you do not want them on a higher floor. You want them as close to the first floor as possible, because they will not get out of the building, because the first responders won't be able to get them out. The ambulances are not structured for bariatric residents or bariatric clients, so they can't even transport them elsewhere. I'm going to move on to what I think is the most important things for you all to know. You've got the presentation. You can get a copy of the PowerPoint. If you are in other than AAA and you are working in a nursing facility, you're working with hospice, you're working with home health, outpatient clinics, community health centers, the Centers for Medicare and Medicaid Services regulate their emergency preparedness plan. So if you're working in those settings, you want to know what that agency's plans are in case you're in the building or with one of their clients or residents during an emergency. The Medicaid elder population is served through our program, as well as the Kentucky Functional and Access Needs Network. Area agencies on aging each have their own emergency preparedness plan. So if you're doing a practicum with a AAA, you certainly want to know what the agency's emergency preparedness plan is. And then if you're a practicum student or a volunteer, you want to, as I said earlier, you want to have your own individual and family emergency plan. Because if you're worried about yourself or your family or your kids, you're not going to be of a lot of use to the client. Now, what every agency needs staff to do, if I leave you with nothing else, number one, you do want to be familiar with your agency's emergency plan. If you are serving your clients during a disaster, do not try to be a cowboy or a cowgirl. Do not operate beyond your expertise. And the reason I say that is there are unintended consequences, and there's a high risk of them with this vulnerable population, and you can get sued. And you have a much higher risk of getting sued individually if you do not follow the agency's plan. If you follow the agency's plan, you're protected by the plan, and then it becomes an agency issue. Use resources that have already been developed. Don't try to create your own resources. There are plenty of resources out there for all the range of your populations. Jamie, you're probably affiliated with the Kentucky Pharmacists Association. They partner with us. I'm part of the Healthcare Coalition Network across all the regions in the state, and we partner with your association all the time, and they're a tremendous partner. Know the location of the closest emergency shelter if you're with a client during an emergency. And last but not least, if you are doing any kind of in-home services with clients, make sure as students that you have personal malpractice insurance. I know I've probably scared some of you. And in a way, I want you to be scared so that you don't do your own thinking. You want to rely on the agency where you're doing your practicum.